There's other techniques within heart math. We're going to get to acupuncture, but heart math is integral to mental health. They work with a lot of PTSD, a lot of stress reduction and management, anxiety, all kinds of different levels of mental health. Heart math is great for it. All right. We're going to talk about Qi and acupuncture today. Who in here has heard of Qi? Okay, good. So Qi is vital energy, but Qi is more of an umbrella term. Qi is energy, blood, body fluids, hormones. Qi is what wakes us up, but it's also what helps us fall asleep. Okay? And this is the pinyin, the Chinese symbol for Qi. And all Chinese symbols, you know, they're very elegant in the way they develop their language. Just on the medical side of the Chinese language, there's over 50,000 of these characters. That's just the medical language. And the normal language, I don't even know if they're countable. But the symbols represent different things, and a lot of times, one word has a long list of meaning, a very broad meaning. So, if you look at this symbol, the lower part is a grain of rice. This represents yin, or material. And the upper symbol represents a wisp of steam, which we often equate to qi, or energy, around us. So as that grain of rice is steaming, still maintaining its material, but that wisp of steam is coming off. And that is what we call qi. Now this gives a little hint to what qi is, and we're going to get into yin and yang in just a moment, but qi, to give you broad terms, qi is abundant and perhaps infinite. Qi is and always has been. Qi controls the body and the shen, which we're going to talk to extensively today. Heart, mind, spirit controls the qi. It is perceived by what it does and how it functions. Qi is always being composed of two polarities. In other words, two ends of a magnet, positive and negative poles. Yin and yang. We call that yin and yang in Chinese medicine. These are continually moving and adjusting to remain in balance for our life. Yin and yang are expressions of the qi, pretty much anything around us. So, to give you an idea of what yin and yang is, yin and yang, the balance of yin and yang is often what Western medicine calls homeostasis. Without homeostasis, without that balance inside and outside the cell in Western medicine, life does not go well if it's out of balance. So we call that balance of yin and yang in Chinese medicine, and yin and yang represent different forces in the world. It's never fixed, it's always dynamic and ever changing depending on genetics, lifestyle, trauma, stress, diet, all these kind of different things will throw this balance off. So yin is cold, yang is hot, yin is night, yang is day, yin is passive, yang is active. Yin is the blood and the fluids. Yang is more energy and qi. Yin is material, so it's the material of the organ, whereas the yang is the immaterial function of the organ. Yin is interior, the inside of the body. Yang is the exterior. Yin is earth. Yang is heaven. And yin is feminine. Yang is masculine. With yin and yang, a lot of times we try to say, well, I like yang better than yin. Yin is better than yang. With Chinese medicine and acupuncture, we don't really think one is better than the other. It doesn't really matter. They both are forces that work with one another, and they balance one another. That's the most important part. Have y'all heard the term psychosomatic? Okay. Good. Preaching to the choir. So when we say psychosomatic, an alternative medicine like acupuncture will say mind, body, spirit connection. And lots of words, but let me just read through them because it's important words. Emotions are, of course, a natural part of being human, right? So feeling joy, fear, anger are all perfectly normal experiences for all of us. We have in our day-to-day lives, but when these emotions become excessive or are repressed and turned inward, then they can become imbalanced, pathological, and cause disease. So we all have these emotions in our day-to-day life, but when they become excessive, say someone has a trauma like war or an auto accident or a divorce or something like that, where someone has a traumatic event in their life that was really important to them. A lot of times Chinese medicine interprets that as that energy sort of getting locked or stuck in the body. And that's where we want to move. We want to move the qi. The belief is that balancing the organ associated with the emotion will balance the emotion. Let me repeat that. The belief is that balancing the organ associated with the emotion will balance the emotion. You see, in Chinese medicine, each organ has a laundry list of associations. So, with the stomach, the element is earth, and with the heart, the element is fire, and with the heart, you have the emotion of joy and excitability and sleep and all these kind of different associations and different colors and tastes and all these kind of things. Sometimes the organ is out of balance and produces the emotional balance. In other words, the body injury or imbalance comes first and brings on an emotional imbalance. But sometimes the emotional imbalance can become first, and then the organ imbalance comes later. So irritable bowel syndrome is one that I commonly see in my clinic. It's a stress-exacerbated or stress-induced digestive issue. And so, in that respect, the emotional imbalance or the stress came first, bringing on a somatic effect. And these things can happen in reverse as well. So my job, the job of a practitioner, all of us, is to evaluate all aspects of our patients. Not just the physical or not just the mental, but look at the imbalance as a whole. Look at that person as a whole person. And then once the imbalance is corrected, the environment that corrected or that created the imbalance no longer exists. Part of my job is to figure out, not just do acupuncture, but we'll also do herbs and lifestyle and diet, and we talk about exercise and all these kind of different things. So when someone comes in and they're really sort of, downtrodden and their shoulders are rotated in and they have a tendency towards depression and they like to sleep a lot, this is a person that's predominantly yin. And so I encourage them to incorporate some yang activities in their life to bring balance. A lot of times when you get them doing a little more vigorous exercise, you get them out in nature, kind of out and open, you get them, encourage them to volunteer or get involved with other people. A lot of times this person begins to, through the treatment plan, begins to stand up a little bit taller, they get a little bit brighter, and they feel better, they feel more balanced in their life. So when we talk about this holistic approach to mind, body, spirit, there's three things we want to consider. We call these the three treasures in Chinese medicine. The Shen, which is the spirit, the Qi, which is the energy, and the Jing, which is the essence. Now, the relationship between Shen, heaven, and earth, Qi is the mediator. So when Chinese medicine says qi, a lot of times in Western medicine we could say quantum energy, that energy that's sort of in between, that we can't really put our finger on. But what we know through scientific experiment, that when you direct or put intention into that quantum field, it changes how those molecules interact. Same thing happens with qi. There's a saying in Chinese medicine, where the mind goes, the qi flows. So setting intention is very important. So when we talk about the Shen, that's the spirit, or it resides in the heart. And when we say heart, there's really no organ association for the mind. When Chinese medicine says heart, we say heart-mind. The heart brings the intelligence in. The mind is considered more of a tool for acting on that intelligence. Okay? And then the qi, it resides in the spleen stomach. When we take in food, when you're eating what you're eating or drinking what you're drinking, that comes in, the body breaks it down into molecules. We know for a fact that these molecules and atoms vibrate continuously. Every cell in our body vibrates continuously. So as those molecules, which Chinese medicine interprets as energy coming into your body, it comes in and builds the person. And then the Jing is also essence. That's considered it's said to reside in the kidneys. This is the inherited energy that we get from our parents, our genetics, our heredity. So we get different influences from the energy. Shen is from a heaven or a higher source. Qi is more earthly plane or in person. And then Jing comes from underneath and solidifies the body. So healthy Shen depends on the strength of the Jing or the essence, which is stored in the kidneys, and Qi produced by spleen and stomach. Shen is dependent on the prenatal before birth, and Jing, the prenatal Jing, and the postnatal after birth Jing. If essence Jing and Qi are healthy, the Shen will be nourished. Now, there's a level of psychology in Chinese medicine. One of the specialties in Chinese medicine is 5-element acupuncture. I don't know if you guys have heard of that before. Mm-hmm. But 5-element looks at all the elements, and every one of us in here has a different element of personality, a different element assigned to us. Some of us are more metal, some of us are more earth, some of us are more fire. It just depends on. You can always tell the fire people, they come in and they're energetic and they go for it. They're sometimes fidgety and restless, and they really have a tendency more towards strong anger. Whereas a metal person, a lung person, would be more of a mental problem solver. But they would have a tendency for sadness and grief. Every association has its positives and its negatives, its yin and yang aspects, okay? So Shen lives in the cardiovascular system in Chinese medicine. The heart houses the mind, spirit, and is considered the emperor in the body. The emperor, Chinese medicine, used a little bit of Confucian hierarchy when it was ranking the organs, and the emperor is the heart, the deputy is the liver, and it just goes on down the hierarchy there of importance in the body. Jing, Qi, and Shen are the three treasures. As I said, they represent three different states of the condensation of Qi, ranging from Jing, more fluid, more material, to Qi, more rarefied, and Shen, more rarefied and immaterial. So you can see this yin and yang relationship coming through. Now, the Shen, or the spirit mind, is visible in the eyes. And I don't know if you've treated patients before where their eyes are really dim, they're really depressed, they're almost not there with you. This is someone who the Shen has separated from. Or you see someone who comes in what we call sanpaku. Sanpaku means three whites. When you look at their eyes, if you can see three whites, meaning white above or below, those two mean two different things, and white on either side of the eyes, and they're like this, sanpaku, what does that mean?
The spirit is separated from the body?
That, but also...
Overstimulated?
Yes, yeah.
You may have a thyroid problem.
Possibly.
They're like perpetually scared or anxious?
Yeah, yeah. You see this in a lot of mental illness. You see sanpaku in a lot of mental illness. You can tell someone is sanpaku or has some sort of mental disorder when they're walking around and they're, you can see it. They look crazy, right? I mean, for lack of a better term, they look like something is going on, okay? So, the Shen is visible in the eyes. But also, when you see someone who has lots of energy, you can see the brightness in their eyes. You look at them and you can just tell, you can see that life, that vitality force in their eyes. So the Shen or the spirit implies our consciousness, wisdom, clarity, awareness, also mental functions, strategy and information processing and decision making. Mental health, the Shen is the seat of emotions. And we're going to get a little bit more into that in just a few minutes. Fruits of the spirit. Vitality, like I said, is visible in the eyes, and our presence, the Shen is our presence, our five senses. So a lot of times with mental illness, the sight's not great, or the taste is off, or the smell's off, or the hearing's off, or something like that, where they're not really in tune with what's going on around them. And a lot of times in trauma, you'll see, like in the ER, when you go in and you sit in the waiting room, you see people just sort of staring in the distance, or they look right through you. Their Shen is separated from their body. They're worried about what's going on right now. So the heart, as you may know, is the first organ to develop in the body about 22, 25 days after conception. And that's why one of the reasons why Chinese medicine calls it the emperor, because it's the first one to get in the body. And a lot of times we think that's because, well, the heart needs to start pumping blood. But in actuality, which is a lot longer talk, actually begins an electrical charge at that point. It begins a magnetism, a wave of influence, a wave of vibration that begins to send information into the nervous system of the body. Ancient cultures, medicines, religions understood the importance of the heart and spirit connection. In the Christian religion, out of the heart flows spirit of living water. In Buddhism, the heart is the seat of the consciousness. In Hinduism, Taoism, Native American, very, very similar. Different ways of expressing it. In traditional Chinese medicine, as I said, we recognize the heart as the emperor of the body being the kingdom. And if the heart's unhappy, the kingdom's unhappy, right? In Ayurvedic medicine, traditional Chinese medicine, Ayurvedic medicine, the two oldest organized medicines in the world, Ayurvedic medicine emphasizes vital importance of the heart as well. And in the Renaissance era, the heart as a seat of emotions. So this is just a few organ associations. A lot of times, and I'm going to touch on depression here in just a minute, be a little more specific. But the organ energetics of stress and emotions, like I said, we have different associations, and this list could go on. I just didn't have room on this slide. You guys will be bored, and I'll be reading forever. So I'm just going to hit a few highlights of what we're, in the context of what we're talking about today. On the left, you see liver. The emotion associated with the liver is anger. And it's normal for everybody to be angry. It's normal. You know, we all have situations where that make us upset or angry. It's when we get to the point where it's excessive or it kind of gets locked in place or stuck. That's when it gets out of balance. So when the emotion's out of balance with the liver, we'll have explosive anger, we'll feel resentment, we'll easily get frustrated, we'll easily be irritable. There'll be some bitterness and some moodiness. It's difficult to pin these people down when their liver's out of balance. Symptoms of organ imbalance, from a somatic point of view, if the liver's out of balance, you'll have chest distension, you'll have a red face, a bitter taste in your mouth, dizziness, tinnitus, jaundice, menstrual irregularities, I treat a lot of that, nausea, vomiting, sighing, breast tenderness, floaters, and tendinitis. There's a lot of somatic associations that we wouldn't necessarily say, yep, that's the liver. But the Chinese medicine acupuncture model really associates and looks at the entire person as to why that liver may be out of balance. And if the liver's out of balance, the person doesn't necessarily have to have all these organ imbalances. It depends on their particular situation, their particular genetics, energetic balance, how they came into a certain situation. All that is in play. Now with the heart, we have the emotion is joy. When the heart is out of balance, emotionally we'll feel a lack of enthusiasm or a lack of will to do things. Lack of vitality, we'll be mentally restless. We'll often be depressed. We'll have insomnia, difficulty quieting the mind. We'll have anxiety, and we'll be easily startled when the heart's out of balance. Symptoms of the organ imbalance, like I said, insomnia, palpitations, irregular heartbeat, excessive dreaming, poor memory and concentration, and spontaneous sweating. The heart is in charge of how the pores contract. And then the kidneys. The association is fear, and that could be somewhat obvious because with the kidneys we often associate fight or flight, or the adrenals. So when we're running from a tiger and we're trying to survive, those kidney adrenals come into play and it starts pumping that adrenaline through. That's that fear. When it's out of balance chronically, you'll have just a sort of a constant sort of low-grade fight or flight, where there'll just be this fearfulness about you. There won't be any willpower. I don't really feel like doing anything today, even though I know I need to. That person will feel insecure, often aloof, and often will isolate themselves. Symptoms of organ imbalance with the kidneys, some of them obvious like frequent urination, incontinence, but not so obvious like they may have vertigo or they may have night sweats. They may have hearing loss or tinnitus, so the kidneys are associated with the ears and hearing. They'll have low back pain. The kidneys govern the low back and they govern the knees. They'll have knee pain as well. Osteoporosis, kidneys govern the complexity and the density of the bones. And then you'll have low libido, also reproduction or infertility could come into play, and also a dry mouth. Any questions about these? Okay. That's a lot of information to throw at you. So what I'd like to do to somewhat reach a conclusion is to talk to you about something I see in my clinic quite often. I'm sure you all do in your professions as well, and that's depression and anxiety. The core diagnosis for depression is and anxiety is liver qi stagnation. Now, liver is responsible for the smooth flow of qi throughout the entire body. That's one of its jobs that it does in our body. And when we have stress, it's known to stagnate the qi. So feeling irritated, feeling frustrated, when you're depressed, oftentimes you feel stuck or you feel like you can't move. That's the liver qi that's stagnated, it's not moving. So part of the strategy is to get in and move that qi, and then immediately that patient kind of feels a release and they can just sort of breathe again. According to traditional Chinese medicine, liver qi can stagnate, become blocked as a result of stress or anxiety. Liver qi is said to be responsible to a large degree for the movement of qi throughout the whole body, as I said. Symptoms that can be caused by liver qi stagnation include, but not limited to, pain or discomfort anywhere along the sides of the body. The sides of the body are generally more liver gallbladder, and that's a pair in Chinese medicine associated with liver gallbladder. Depression, mood swings, as I said before, moodiness. When a person sighs a lot, they're trying to move the qi, okay? That's depression. When they have hiccups a lot, that's the liver insulting the digestion and kind of rebelling it upwards. When they get frustrated easy or they have inappropriate anger, when they get angry at the things that they probably should be a little more grounded with or not be too angry with. A sensation of lump in the throat. In Chinese medicine, we call that plum stone or plum pit qi. And as someone who, you see that a lot with mental illness, someone who just, I have sinuses, I have phlegm, but even out of season when the sinuses aren't affected, they're still kind of clearing their throat. So this is qi stagnation, a telltale sign of qi stagnation. And there's a perfect herbal formula for it. Difficulty swallowing, same kind of mechanism. A bitter taste in the mouth, and people don't necessarily register that, but that's when the liver gallbladder is operating too hot, it'll send reflux up, and that's essentially reflux. Bitter taste in the mouth. Acid reflux. Excessive sleep, someone who feels like they need to sleep longer than they probably should for their age and body type. Tendency towards constipation, so just as the mood would feel stuck or someone would feel stuck and depressed, the constipation or the bowel system somatically begins to get stuck as well. And a lot of times the stools will be more pebble-shaped. And we do talk about bowel movements and stools and urination, all that kind of stuff in my job. Abdominal pain and discomfort, and usually more of a hypochondriac pain where it'll be above the belly button, below the ribs. A stomach ache that improves with pressure, so as you kind of rub it, it kind of goes away. So you're actually rubbing it and moving the energy out of the area. Stomach ache that worsens with anger. So you can look at that as maybe a stomach ulcer. Someone gets really angry. We know they develop ulcers from worrying and being too angry and having too much stress in their life. So as the stress gets worse, the stomach ache gets worse. And then with more gynecological situations, a lot of times when there's excessive PMS or there's mood swings during the premenstrual time, irritability, or there's more painful or swelling in the breasts, even development of the fibroids, those are all liver qi stagnation and can be relatively easily remedied with some treatment. And oftentimes irregular painful periods, the liver is the governor of the menstrual cycle. So it gathers up the blood prior to the menses being discharged. So as it gathers up and if the liver is stagnated and has a little bit of imbalance in there, it's going to send or reflect that imbalance in the menstrual flow. So menstrual flow that would have excessive clots in it, especially the darker clots, a darker blood, intense cramps in the lower abdomen would be more of a liver issue with their menstrual cycle. If there's low back cramps, then there's liver and kidney involved. Churning sensation in the stomach, so your stomach never really feels settled. We call that overrhythmus, which is kind of your water pipe sounds. If that's happening a lot, then your liver's insulting your digestion a little bit. Panic and anxiety. When the liver is stagnated for a long time, it begins to insult because it is the deputy. It has a lot of functions in the body. And as it gets stagnated, it's going to begin to insult or overact on some of the other organ systems. And so one of the most common scenarios I see when depression transforms into anxiety, or there's a sort of like bipolar, or manic depressive, where they're kind of going back and forth between the two, the liver is starting to have more of an influence and send heat up to the heart, and it's starting to make the person feel restless. We know heat rises in nature, and so when that liver gets a little bit too hot, it's going to rise up in the body and a lot of the upper body symptoms. And in the same situation with panic and anxiety, there's insomnia, there's difficulty quieting the mind, there's a mental restlessness, all those things associated with anxiety. And then there's a kidney component in there too with the fear, but that's more of a chronicity. And a preoccupation. So liver qi stagnation, this is something where someone keeps ruminating over the same thing, can't get past it. This is liver qi stagnation. And so often in the clinic, what we see, we look at the health history. We talk with the patient for about 45 minutes in the first time. And we also take their pulse and we look at their tongue. With the tongue and with the pulse, there's organ associations with the positions. So if you stick your tongue out and you turn it over, this is the tip of your tongue, the back of your tongue. Tip of your tongue is your heart, and just behind that's your lungs. You've got digestion's in the middle, liver and gallbladder on the sides, kidneys, reproductive organs, intestines at the root. So if you put it next to your torso, it's loosely associated where all the organs are, okay? So with the tongue, we look at color, cracks, coating, teeth marks, size of the tongue, moisture, all these kind of different things. And where those inconsistencies are in the areas of the tongue, this points us to lean towards one certain pattern or another pattern. With the tongue and liver qi stagnation, the tongue will be somewhat normal